But in a lot of these injuries that didn't require surgery, we kind of were coming up against a wall. So as time went on and we were able to, build a new building and expand a little bit and have nurse practitioners, we wanted to expand our offerings. So our nurse practitioners have been doing PRP injections for a while, and that has been very, very successful. We've had a lot of patients who, just were doing okay. We're starting to respond, but didn't have that, there was just something missing. And the PRP injection kind of put them over the top. And then recently we got to meet Dr. Qureshi, and it was kind of cool. He actually found us, and we went out to lunch and we started talking, and we immediately knew that when it came to this type of medicine, he was way smarter than we were. That was the first thing we knew. And then in the same way that most chiropractors, myself included, have that, chronic low back pain history that drew them into what we do, Dr. Qureshi has a regenerative medicine story that I think he's going to share with you over the course of the evening. So, so that's what made us partner up and what made us choose him. And we're super excited to have him. And we hope that you'll learn something tonight from what he has to offer. So our primary objective now hasn't changed, which is our little motto, our slogan at League City Spine is to get you back in the game of life. Which changed in our practice is that we now have more toys to do it to get you there. So that's the big change. The heart of what we do is the same. So with that, I'd like to introduce Dr. Mohamed Qureshi and turn the presentation over to him.
Hello, everyone. It's very nice to meet you. My name is Dr. Mohamed Qureshi. I'm a primary care sports medicine physician. I work alongside Dr. J with League City Spine and Sports Medicine, and I'm currently the medical director for League City Spine. A little bit about my story. I have a great passion for orthopedics, just like how Dr. J mentioned some of the passions he has toward musculoskeletal medicine. I myself also have a close fondness toward orthopedics. A little bit about myself. I used to play high school football, and I actually tore a meniscus when I was 18 and needed knee surgery at that time. And a few years later, I was in a basketball tournament and tore my meniscus again in the same knee. So that's definitely, I'm not foreign to knee pain and orthopedic related procedures and surgery. It was really my first exposure to the medical field, and it really led to a lasting impression within my heart and helped guide me throughout the course of my studies and ultimately to my residency training. So some of the things that we treat as sports medicine physicians is osteoarthritis. So what is osteoarthritis? It is a chronic degenerative condition that usually results from wear and tear. How does it develop? There's many factors behind it. There's the wear and tear part of it. But there's a lot more things that are coming into light about how it develops and why it develops, and has really piqued a great interest in the orthopedic community, and is very relevant for the patients that we see today. Particularly in this country, we see that osteoarthritis affects more than 30 million patients within the United States. It frequently involves many of the large joints, including our hips, our knees, our ankles, shoulders. And there are, a wide variety of ways to treat osteoarthritis, which I'm going to talk about in a little bit. Another common condition or common conditions that sports medicine physicians treat are soft tissue disorders. And among them, the most common being tendonitis. So what is tendonitis? It's usually an overuse injury, usually seen in not just athletes, but also active individuals who play sports like golf and tennis and other sports like basketball. You're going to see a lot of these issues. And how does it develop? Whenever we have issues with the tendon, like tendonitis, there's a lot of inflammation there, and whenever that inflammation is present for a long period of time, that can lead to enlargement of that tendon, and that usually causes a lot of problems in terms of pain and limitations of function. There are a variety of ways to treat soft tissue disorders as well. Many of being steroid injections into or close around the region. That's one way to start. Physical therapy, but there are also more treatment options that I want to talk about shortly. So another common joint, again, that we find a lot of issue with is the knee. It's the most common joint involved with osteoarthritis, as mentioned before, but there are other causes of knee pain, including acute issues like ACL, meniscus tears, other ligament problems, as well as issues surrounding the joint, including the muscles and some of the soft tissue. So as sports medicine physicians, we're trained to help examine these major joints and to kind of tease out what are multiple factors or sources of pain that patients experience. And seeing me or seeing any of our orthopedic providers, we're able to kind of dissect that, break that down for you, and help you understand exactly what's going on. So some of the treatments, like I was mentioning before, for osteoarthritis include corticosteroid injections, gel injections like hyaluronic acid injections, as well as strengthening the joint through utilities like physical therapy. And it's always important whenever discussing care with our patients regarding these conditions that these conservative measures have been tried, and a lot of people have gone through the gambit of this, and that's something I myself can say that I have when dealing with chronic knee issues, and that is definitely something that when seeing our patients in clinic, we're going to dive into and really look at the history and see what kind of things have been tried and where our patients are hitting that wall. And then what we're going to be discussing a little bit further again are some of the newer technologies, some of the this newer kind of field called regenerative medicine that's really sprung up over the last 20-25 years. So just a quick tidbit about meniscus tears. Meniscus tears, the meniscus itself it serves as one of our major shock absorbers within the knee. And many times it can be torn or damaged acutely through sport injuries, through day-to-day activities, through accidents. And then for more of a chronic issue, in conjunction with arthritis, sometimes we see these tears happen just from plain wear and tear. So a lot of times when people visit their surgeons or orthopedic surgeons or orthopedic specialists and get MRIs ordered, oftentimes we do see tears. It's always important to evaluate, what kind of tear is this? Does it need surgery? And what kind of options can be utilized to help with this? The reason being, a lot of times with surgery, what they do is they go in with some small cameras and they kind of shave off part of that shock absorber, which in the short term can help people feel better and even help joints move better. But essentially it's taken away some of that shock absorbing capacity that the joint has and can actually cause a lot of trouble down the road. So one other thing I wanted to touch base on this slide, there have been a lot of studies, a lot of research that has shown that some of these regenerative medicine options can help, not just with osteoarthritis, but also soft tissue disorders such as meniscus tears, and as well as ACL tears, and knees that have already gone through surgery and are affected by changes that have occurred inside a joint because of surgery itself. So a little bit more about me and my story. After I finished my family medicine program in Virginia, I went into a sports medicine fellowship at Campbell University in North Carolina. And there I met Dr. Andrew Martin, who was my fellowship director and a mentor for me. And he really introduced me to the field of regenerative medicine. I was able to explore different technologies, the latest technologies with platelet-rich plasma, as well as stem cell therapies with bone marrow aspirates. That's when I kind of started to consider if I may be a good candidate, as I have already had a few knee surgeries at this point in my life, and especially with residency and the toils it involves, I was not taking care of myself in the best way. I did gain some weight at that time in residency and was having a lot of pain and functional limitation. And for me, being an active individual, that really affected my activities of daily living in terms of how active I like to be, and being that weekend warrior, and impacted my quality of life. And for the longest time, after seeing my own doctors, they really didn't have much to offer besides steroid injections, as well as just pain medication. And that's something I myself wasn't a big fan of. And I always believed that, or I actually hoped and believed that there can be better options, and that there should be better options for patients who suffer not just trauma to the joints, but also just the normal wear and tear and development of arthritis. So that's when I started considering myself, taking a look at a lot of the literature and looking at the different options, and to see how can I treat my own knee. Okay. So during my fellowship, I actually put together a protocol using regenerative medicine techniques like platelet-rich plasma, bone marrow aspirates, as well as some other technology such as hyaluronic acid, or commonly known as gel shots. And I put together this protocol and I tested it on myself. And that's where Dr. Martin and I came together, and we decided, let's go for it, let's see. And I ended up getting my own radiographs before the procedure. I also went through a lot of health kind of awareness and consciousness, and went on a mission to lose weight, strengthen my joint, and then executed and went through with this protocol on my own knee. At first, it definitely was something, very, very much something new to me. And it drove me to learn as much as I could about it, as much as I could about these different technologies, these new procedures. And my fellowship director definitely saw that, and actually tailored part of my fellowship training to be able to get more experience working with some of the leading some of the leading physicians in regenerative medicine in North Carolina at that time. So I was able to get formally trained with bone marrow aspirates, PRP injections, hyaluronic acid injections, and the months and now years since that time have been tremendous. Have had a tremendous impact on my life, my quality of life, and my own self-confidence within my joint, regarding my joint and regarding my musculoskeletal health. It's one of the best decisions I personally have made in my life, and has definitely been something that drove me to further my desire to study this. And over the few years after my fellowship, I actually launched my own research project, which recently received FDA approval last summer, and definitely spurned and continues to spurn an interest and a burning desire within myself. So what are some of these technologies, some of these regenerative medicine options? Platelet-rich plasma, it's a kind of has become popularized in culture, and and has been seen in different fields. Dermatology is a field, and orthopedics is definitely one of the two major fields that we've seen it. While its popularity has become somewhat of a newer phenomenon, it's actually been around since the 1960s, and the earliest documented cases of using platelet-rich plasma was in developing platelet plugs for treating chondral or bone issues within jaws in the field of dentistry. And then the area where platelet-rich plasma later on again found roots was in orthopedics. What pretty much basically what platelet-rich plasma does is it helps reinvigorate the healing process within our body. Now, since it's been around for some time, since the 60s, there are a lot of companies that do offer platelet-rich plasma. And there's a mixture of different quality of products, from the most basic centrifuges to some of the more technologically advanced pieces that exist right now. And that's where I just kind of wanted to show a little bit about the system that we are using right now. We do have one of the more basic centrifuges available for our patients, platelet-rich plasma, but we're also incorporating the Arthritis Angel system. Arthritis being one of the major orthopedic surgery companies based out of Naples, Florida. What pretty much the Arthritis Angel system does is it delivers a very high quality platelet-rich plasma product. It is one of the latest technologies in the field of orthopedics. And a lot of times when you look at the research, quality does count in terms of efficacy, in terms of how well do these products end up treating these disorders. So what does platelet-rich plasma involve? What does the procedure itself entail? It often entails a simple blood draw, just like if you were donating any blood. What we do is we collect a sample of whole blood from the vein, and then we use the Arthritis Angel centrifuge with a customizable design to be able to maximize the quality of the product. And then we end up using or preparing that platelet-rich product, and then using ultrasound guidance to be able to deliver it with pristine precision, either into soft tissues or joints such as the knee. So again, why Arthritis Angel system? Again, it's a high
Doc,
quality.
Before you go into the next slide, do you mind if I show something real quick and let you have a sip of water real quick?
Yeah, sure, go ahead.
All right, go back 2 slides. From somebody who doesn't do this all day long, I just like to show you what amazed me about this Arthritis Angel that Dr. Qureshi's brought into our office. So this is a typical, just a blood draw tube. Our current PRP tubes are slightly more sophisticated in that they have a bottleneck in the middle. But basically, we spin the PRP down, and this is the PRP section right here. And they take a syringe and harvest it from outside of there. Now, go forward 1 slide. This is that Angel system that Dr. Qureshi loves. And now I understand why. When he came on board, he was like, look, if we're going to do this, I want the ability. He's like, we can continue to do it the old way too, but I want the ability to do it on steroids. And I was like, okay, I got to see this. So you can't tell here, but the blood's gone in here. This control panel allows Dr. Qureshi to fine tune and tell it exactly what products he wants. Then there's a light sensor here that reads the blood coming through, okay? It goes into the centrifuge and spins down in the centrifuge. And then there are 3 different products that come out of this thing. So you have your red blood cells in that bag. You have your PPP, which is your platelet poor plasma. And then up in this syringe up top, that's PPP. That's the platelet rich, PRP, the platelet rich plasma, I'm sorry. And the amount of concentrate that you get off of this collection process is just insane compared to our other. So just for Dr. Qureshi knows so much about this that I don't think like when he brought this in and I saw the first one come through, it blew me away. So I just wanted to show some of the highlights. Doc, thank you for letting me steal your thunder.
Oh, no, absolutely. Yeah, thanks. Yeah, I really like that. So why does quality matter? The reason why quality matters, and if you look at some of the literature, is the higher quality product, the more the more chance that there will be better outcomes. What does this mean for me? What does it mean for you? When we talk about better outcomes, we talk about improvement in our pain scores, improved function, as well as increased endurance. And those are everything that some of the things that I felt when I started, after I had this procedure done, and it really changed my life. It really did, and this is something that's very important. So just basically, how does PRP work? So platelets are some of the cells found in our whole blood. And as commonly known, they're involved in helping us stop bleeding if we ever get cut, if we ever get a wound. But what a lot of us may not know or understand is that these platelets, they contain growth factors. These growth factors, they help perform a multitude of tasks, multitude of functions, including helping suppress inflammation, helping recruit our native cells for healing purposes, and helping accelerate healing of older injuries when it's used with a platelet-rich product. Okay, so we talked a little bit about platelet-rich plasma. I wanted to touch a little bit on bone marrow aspirate concentrate, or BMAC. And this is very important because there are a lot of clinics out there that advertise stem cell treatments, or they'll help sell like an amniotic product or anything like that. To me personally, the most efficacious, or the product that benefits patients the most are those that are taken from the patients themselves, something that's taken on the same day and prepared and delivered to the patient the same day. A lot of times those companies or these clinics that sell these stem cell products, they go through a series of packaging, freezing, preservation. By the time that occurs, a lot of these cells die. And the only thing that is left is just a series of growth factors, which can help, but it's not necessarily stem cell treatment. When we talk about stem cell treatment, we have to always differentiate, where is the source coming from, and whether this is like a pre-prepared product. And what we are doing is something called bone marrow aspirates, and developing it and making it a concentrated product. So the reason why this is important is, one, when you collect the sample on the same day, it helps those cells survive, and it's a very high quality product when it comes to like stem cells for our patients. The process that is involved for preparing this would be a bone marrow aspiration. A lot of times this bone marrow aspirations have been performed in clinics, and those are sometimes for diagnostic reasons, for like an oncologist or a cancer doctor. For us, we're using bone marrow aspirates more for therapeutic reasons, where we're collecting the stem cells from a patient's hip and then preparing it to help deliver into whatever tissue that needs to be treated, including arthritic joints and soft tissues. So the beautiful thing about the Arthritis Angel system is that it helps, it can help prepare a platelet-rich product, but it can also help process bone marrow aspirates as well. So it has a dual role, which is pretty fascinating and very, very useful for treating physicians to help their patients. And again, just like the platelet-rich product, with bone marrow aspirates, once the product is prepared, we use ultrasound guidance to be able to deliver that final product with precision within joints or within soft tissues. So just a little bit more about bone marrow aspirates. There's a few different locations, a few different sources where stem cells can be taken from the body. One being our hip, which is the most common source, as well as one being our adipose or our fatty tissues. So what we're going to be doing is getting it from the hip or the backside of the hip, and that's exactly what I did when I enlisted in getting a bone marrow procedure done, was get it from the backside of my right hip. So numerous data exist regarding the efficacy of using bone marrow treatments or bone marrow aspirates in treating conditions like osteoarthritis. And we've seen benefit of it in not only arthritis of the knee, but arthritis of the ankle, arthritis of the hip, arthritis within most major joints. Okay. So how does bone marrow aspirates work? So what is the difference between a PRP and a bone marrow aspirate? So one, the PRP again is taken from our whole blood, like a blood draw through venous blood. And then the source, again, bone marrow aspirates are different. And they both are sources of blood, but where does the difference come from? So if we think of PRP or like our venous system or our whole blood, we can kind of think of it as the freeway, and that freeway has cars, and those cars are already built, and they're running, they're doing their job. Bone marrow aspirates, when we talk about bone marrow aspirates, we're talking about the manufacture plant. We're talking about the area where where the parts that build those cars are developed. And when we are taking the source of cells from there, it is completely different in terms of the potency, in terms of the cells that we're gathering, and their reparative potential. So how do these stem cells work? That's another great question. So are these stem cells that we think classically of, that they go in and then they lay out and they can differentiate into any tissue? And the answer is no. There is nothing controversial regarding this. We're not talking about fetal cells. We're not talking about any of those kind of things. These are partially differentiated cells that help produce structures that are native to joints. And that's the beauty of this, of PRP and of bone marrow, is that these are your tissues, these are your cells that are helping treat your joints and your tendons and your ligaments. Okay. So the way that these stem cells work is that they are manager cells that help joints pretty much stay healthy. They also help suppress inflammation and promote healing. And they can differentiate and form new structures like cartilage, like collagen, the structures that are needed to maintain a healthy joint. Okay, so once the procedure is performed, once we do use the ultrasound, once the product is prepared, once it's delivered, what can we expect? What can patients expect? And I can speak from my own personal experience. You can expect some soreness near the preparation or the preparation site. For bone marrow, it's going to be from the backside of our hip. You can expect a little bit of swelling, a little bit of soreness there, and that can last about a week. And then once you actually inject into joints, you can expect some mild injection site soreness near the injection site for the past week. I actually just injected my mom probably like a month ago at League City Spine, and I've been tracking her progress every day, as I'm seeing her every day. And she had a little bit of this. She was having a little bit of injection site soreness, and I reassured her that it will be fine. And after a few weeks, it really subsided, and she feels great right now. She really feels happy that she ended up getting the PRP done. So that's just something that if you look at a lot of the studies in terms of common side effects, that is expected to happen and is not unusual, and it's not harmful to our patients or to our joints. It's just something that happens because these are very powerful cells, and when we do inject it into it, it can cause a little bit of mild local swelling. Most patients, they do well with just Tylenol and just staying hydrated. So fast forward from recovery time, what can we expect from these procedures? So for bone marrow aspirates, we really get the most bang for our buck with this, especially when we're considering joints that are just beginning to have arthritis or just starting to become symptomatic. Some research has shown improvement 5 years after the procedure, after the injection that's done, and that's fantastic. Those are a very, very good time frame in terms of symptom recovery, especially when we talk about steroid injections nowadays. We usually try to wait at least 3 months before repeating steroid injections, and most people, they need 1 or 2 steroid injections a year to help get their joints through. And that's a lot of research is coming out, really kind of shying against long-term steroid exposure within our soft tissues, within our joints, because long-term it can be doing a little bit more harm than benefit. So to expect some studies showing about 5 years of improvement, that's fantastic, especially someone who's entertaining the idea of joint replacement, who's really where this is impacting their quality of life, especially younger patients, younger post-traumatic joints. That's definitely something close to my heart, and people that I definitely would love to see and would love to see if they would be good candidates for this treatment option. Absolutely. So again, with League City Spine and Sports, I really like their model. It's a comprehensive model. It's a very I look at Dr. J as my colleague and vice versa, and we're really trying to help maintain function, maintain quality, and relieve our patients' pain so that they can enjoy the activities they've always enjoyed when they were younger in life and when they are now, to kind of rediscover our younger selves on a day-to-day basis. So, with that, I'll hand it back over to Dr. J if anyone has any questions.
So, and Doc, actually, I have a question for you. My current knowledge is that your average knee replacement lasts, if we're lucky, about 20 years. Is that still pretty much the number?
About 10 years. 10.
Really? Yeah, usually, that low?
Absolutely.
Okay.
Yeah, usually we require repeat revision procedure. Sometimes, depending on the quality of the joint replacement, some people require revisions a year or 2 out if there is some complication. But most people, even if with good procedure, need a return to surgery and another arthroplasty or another joint replacement within 10 years.
So when we say that BMAC's a great thing for younger people, we're talking younger, even 40s, 50s, 60s, maybe even touching 70, because the goal is to only, if you have to have the knee replacement, only have it once, right?
Sure.
So we're trying to just push back that clock.
Absolutely.
Okay. So I just that was my understanding, and when you said younger, I don't want anybody to think we're talking 22-year-olds, which maybe especially post-traumatic and people coming out of the military with injuries, absolutely, but it's also kind of anybody who's trying to postpone what may be the inevitable, but trying to put it off as long as possible and have a high quality of life in the meantime.
Absolutely. I mean, there have been studies that even show that end-stage joint diseases, grade 4, arthritis, when utilizing bone marrow aspirates, they can receive symptom relief, which is huge.
Really, that's crazy.
Yeah, which is huge, which is something that can help and benefit our symptom scores, our function, our endurance, even with advanced stage disease.
Well, that's awesome. All right, so with that, we'll open for any other questions. I haven't gotten any in the messenger. Does anybody have any questions for Dr. Qureshi? All right, well, that makes life easy. So if anybody is interested, you can put a message in the and the process behind this. And actually, I think Doc's got the next. I think we skipped one slide.
Yeah, there was one I forgot to mention.
So so if you're interested in evaluation, you know, recent lab work is always great. MRIs, you know, and Doc has up there 2 to 5 years old, provided that there's not a fresh injury since then, obviously. You know, so as long as that imaging is pretty current with what's your current presentation is. If you don't have MRIs, we can order them, or Dr. Qureshi can do an ultrasound in the office and scan it that way, which is a little bit more cost effective. But to be clear, not quite as clinically. The MRI is a little higher level of clinical excellence versus an ultrasound scan. So the process, if anybody's interested, is to set up a consult with Dr. Qureshi. You can call the office and set that up. If you put anything on this chat messenger, I can have our team reach out to you tomorrow. He's in the office. He'll be in a couple of days in May, and we can set up a consult. We also will have an option to do those via telemed. So, you know, it's whatever works best for you. And like Doc kind of alluded to, and you know, in our office, we always look at things from this perspective. So we always look at what is going to be the least invasive and the least expensive, and then we work our way up the line to the most invasive and the most expensive, and just work through the progress. So, for example, if you have degenerative knees and you're on Medicare, we might start with just hyaluronic acid because it's going to be 100%, or for the most part, covered by Medicare. And then if that doesn't work, then we can always, hey, why don't we try the hyaluronic acid with some PRP, or you know, kind of be creative there. So most of what we discussed tonight is not covered by Medicare, not covered by insurance, but our pricing is very, very transparent, and we can answer any of those questions in the office, and it's also extremely competitive because, you know, our goal is we're looking to provide these services to our patients who we know have gone elsewhere and gotten stuff that we weren't too excited about, and maybe didn't get the results we would expect them, but unfortunately paid a lot for it. So we're trying to make sure that we make this something that is accessible to all of our patients, or as many of our patients as possible. So with that, if nobody has any questions, we thank you for your time, and we look forward to seeing you soon.